Good evening. My name is Janitra Moore, and I'm here to talk to you about some medications for Principles 3. The first medication I'm going to discuss is ephedrine. Ephedrine is an indirect synthetic non-catecholamine, which indirectly stimulates norepinephrine release from the nerve endings, which also increases blood pressure, heart rate, and the systemic vascular resistance. This medication comes in either a 5 milligram per ml syringe, or you can get it in a 10 milligram per ml syringe, depending on what location you're at. The dose is typically 2.5 milligrams to up to 10 milligrams IV push. It does not come into a continuous medication bag or a infusion. Its onset is usually immediately, and the duration of action is 1 to 1.5 hours. The next medication I'm going to talk to you about is dobutamine. Dobutamine is classified as a beta-1 adrenergic agonist. The typical concentration is 500 milligrams in a 250 normal saline bag or a D5W bag. Continuous infusion dose that you can give is 2.5 to 40 mics per kilogram per minute, and the mechanism of action for this medication is a direct beta-1 agonist, so it acts directly on the heart, on the beta receptors on the heart. The onset is 1 to 2 minutes, and duration of action for this medication is 10 minutes. And this medication is used to give the heart a stronger contraction. The next medication is nicardipine. This is classified as a DHP calcium channel blocker. The mechanism of action for this medication is it binds to the voltage gate L channel, the L-type channels, which blocks calcium influx into the myocardium and smooth muscle cells by preventing the excitation, coupling, and contraction. And it has a greater affinity for the vascular smooth muscle. So it's really used with the arterial vasodilator. The typical concentration for this medication is 25 milligrams in a 10 ml dose vial, or you can get 2.5 milligrams per ml. So when you mix this medication, you can mix it in a 250 ml bag of normal saline or D5W, which will give you 100 mics per ml. For a continuous infusion for this medication, especially for hypertension, you can use an initial dose of 5 milligrams per hour, and you have a max dose up to 15 milligrams per hour. You can titrate this medication to 2.5 milligrams until you get the desired peak blood pressure. The onset is 1 minute. The duration of action is 2 to 10 minutes. The next medication I'm going to talk to you about is atropine. Excuse me. This is classified as a anticholinergic drug or medication. The typical concentration, the typical concentration of this medication is 0.1 milligrams per ml, and the dose for symptomatic bradycardia is 0.5 milligrams up to 3 milligrams total dose. This is not a continuous infusion that is given. The mechanism of action is it competitively antagonizes acetylcholine at the muscarinic receptor sites. The onset of action for this particular medication is 1 minute, and the duration can be from 1 to 4 hours. The next medication is similar to atropine, which is glycopyrrolate. And it too is an anticholinergic medication, but also it's an antisalagal, which also competitively antagonizes the acetylcholine at the muscarinic receptors. The typical concentration for this medication, that depending on where you're at, that you can see a vial that's only 0.2 milligrams per ml, or you see the medication in a vial of 0.4 milligrams per 2 mLs. The onset is 4 minutes. The duration of action is 2 to 6 hours. The next medication I'm going to talk to you or discuss is esmolol. Esmolol is a beta-1 antagonist. The typical concentration for esmolol that you will see is 10 milligrams in 10 milligrams per ml vial. The infusion and bolus ranges for this medication is 0.2 to 0.5 milligrams per kilogram. Or you can do an infusion for hypertension is 50 to 250 mics per kilogram per minute. This medication works by antagonizing the beta 1. It slows the sinus rate and the conduction of the cardiac impulses through the AV node, and it decreases the entropy. The onset is 1 to 2 minutes. The duration is 10 to 30 minutes for this medication in particular. The next medication is labetalol. It's classified as a beta 1 a beta blocker, beta 1 and beta 2, but also it has effects on alpha 1. It's applied in 5 milligrams per ml vial. The typical dose, it ranges from 0.25 milligrams per kilogram IV push every 10 minutes, or you can also use the 0.05 milligrams per kilograms per minute IV infusion. Like I was saying before, this is an alpha 1 blocker also, not just beta. So you can get a 7 to 1 beta to alpha blockade with this medication. But this medication in particular lacks the effects on alpha 2 receptors, which allows norepinephrine release, and it decreases the catecholamines with that negative feedback system. The onset of this medication is 2 to 5 minutes. The duration of action is 2 to 4. So you want to be careful when you give this medication, because once you give it, you're stuck with it for a while, and you're blocking your betas and your alphas. And the last medication I wanted to talk to you guys or discuss is hydralazine. And it's classified as an arterial vasodilator. However, it states that this medication can open the potassium channels that allows relaxation of the arterial smooth muscles, or it has some effect with nitric oxide as a stimulator also. The actual process behind it is really unknown. But the typical concentration that you would see is 20 milligrams per ml vial. You can give 5 to 20 milligrams, and the onset of this medication is 15 minutes. So once you give it, you wait and let it react. The duration of action for this medication is 2 to 24 hours. So that's the end of the medications that I have for you to discuss. I thank you for listening, and you have a great day.